Hello, this is Dr. Lewerenz at Longevity Health Institute. Good evening or afternoon. Hope this finds you well early April. I want to tell you about what personalized medicine is. And actually, I'm kind of impassioned right now because of two cases today. As the universe would have it and God wills, we had some great results today. Really exciting, and two patients of ours did wonderful, and it's exciting to share this with you and share with others. Both patients actually in this personalized medical approach that we do here at Longevity Health Institute with myself and practitioners, we actually look at everybody in details at really low levels of foundational systems, and that's essentially what personalized medicine is looking at you individually, listening, interpreting, looking a little deeper than some Western or if you will, or conventional approaches. So what did we do? Well, two of my patients, one, let me talk just really simple, very young adult female, literally since her teens, years of vaginal yeast infections. Chronic yeast infection, could never get rid of, on and off of antifungals because of this. Chronic, not to sound too descriptive, but discharge. And if you're a female out there, you would know that how difficult and uncomfortable and unfortunate this is. Couldn't pin it down with her OB-GYN exactly why and what was causing it. Comes in, and in one visit, after 2 months of therapy, and I'll tell you exactly what we did for this, it is resolved, and it's never been resolved since her teenage years, and she's in her early 20s. So what is and what can cause chronic yeast infections in the body? And in her case, obviously, it was gynecologic, vaginal yeast infection, which is very common. And a lot of people around the country and world suffer from this, and you don't always need a antifungal medication to get rid of it, because that is treating it, but it's also just treating the symptom of it and not necessarily permanently mitigating what the problem is. So we harbor yeast in our system. We typically have about 7 to 10% of yeast in our biome of our gut and our digestive system and that. And yeast loves opportunistic areas to come out. It loves to come out in our mouth as oral thrush. It loves to come out in hot, dark, sweaty areas like our armpits and our feet and our groin and stuff like this. And they're on the skin and that. And they're red and itchy and dischargy and smelly, etc. But it's all yeast, okay? And it's actually a product of candida or yeast coming out of the body. And what will extrapolate it coming out? Well, stress can always do it, as many things stress causes, makes everything worse, but also diets that are rich and high in carbohydrates and sugars, particularly refined sugars, really feed candida and feed yeast, and then it'll flourish. And if it flourishes, it loves to flourish in hot, dark, wet, sweaty environments, okay? But that's not necessarily the cause. What there is there's an imbalance in your good and bad flora at the digestive lining. And she had never been approached by this way, but we looked at her blood on our live microscope, our live blood analysis, and looked at her blood and did a cytology analysis and looked at her blood in our dark field and in our dry blood. And long story short, she had large amounts of yeast in her blood, which is very indicative of candida and an overgrowth in her digestive system. Of course, she was not aware of this, but she is young and healthy and eats a very American, high carbohydrate, rich sugar, high refined diet. The problem with this is it's just feeding her problem, and she never made the association. Yeast loves sugar, and sugar just feeds the yeast, and just like bread or like a cake in the oven, it rises and spreads. So what do we have to do? Well, we changed her diet to a low carbohydrate diet, a low refined sugar diet, basically no sugar diet, but got her off a lot of her carbs. Requested and encouraged her to be gluten-free because of the many benefits of gluten-free diets that actually help the lining regenerate at the gut. And then we put her on high-quality probiotics that are live, multiple strains of Bifidobacterium, Lactobacillus, Acidophilus, Saccharomyces boulardii. We have a product here that's got a lot of good bacterial flora, several strains, and we actually, on her case, because it was so bad and so prominent, we use actually in the 200 billions colony counts of these good live probiotics. In changing her diet and doing that, we also then put her on low dose oral hydrosol ionized silver called Argentine 23. It's a water soluble oral ingestible silver that she did sublingually a couple times a day. Wiped out her yeast, wiped out her candida. Has not had discharge or a symptom since. We looked at her blood today, much improved on our live blood. She's doing wonderful. Now I probably will keep her on that protocol for another several months. But this mitigated and permanently likely will fix her issue if she stays with this, and we'll probably do another follow-up in 2-3 months. But again, a result within months, and something she had suffered for years, and something that not only just helped her quality of life in this aggravating effect, but also is really what we did is changed her biome, her gut biome. We altered her flora in a positive way, got rid of yeast, and this ultimately fixed a lot of, and she's not even aware of this, immune issues, balanced her immune system, because that's at your gut level, your digestive level. So I know you've heard me speak of this before, but hopefully that educates and enlightens you. Case number 2, I had a patient follow up, and this is their words, his husband and wife saved their life. And that excites me because when this happens, we screened him for something that he came in for that he was unaware of. He is a very youthful 74, I believe. Very youthful, active, very active in the yard every day, goes to the gym, goes on the treadmill, works out. At 74 years old, he is retired, he is fit. 0 cardiac symptoms, no shortness of breath, no chest pain, no high blood pressure, 0 symptoms. Mildly elevated cholesterol, 74 years old. Well, he had erectile dysfunction, and he actually had taken a Viagra and tried Cialis a few times with very, very minimal effects, results, positive effects. So these medications, these PD5 inhibitor medications that cause increase of nitric oxide in blood flow to the male genital to enhance a sexual encounter and help erections, it wasn't very successful for him. And this, to me, did not make sense. When you have erectile dysfunction, that's a vascular issue, and usually these PD5 inhibitor medications like Viagra and Cialis should work, at least to a significant degree, and to him it wasn't very successful at all. And that was his main symptom. He was here with his wife, and his wife is a patient also. This was his first visit, actually, when we came across this. So what did we do? Well, because of my concern on this, and because he was so active, I did not want to just put him through a cardiac treadmill stress test, because there's a significant percentage of people that will pass this and actually have heart attacks and have vascular and heart disease. And the reason is because they're in shape, and their target heart range, their maximum target heart range, where they'll stop and cut off, the cardiologist that does the test will cut off the test and say, you're fine, you pass, go home, you pass with flying colors, I'll tell your doctor, is because they are in shape and they are pretty active, and they look better than it sounds, and they're 74, so they're doing great. They get blown off. I hate to say it like that, but they don't push the cardiovascular status of them. They usually take those patients to about 85% their maximum heart rate, and that's just predicted, calculated. So if you're fit, you can easily do that, and you can have heart disease. So we did a cardiac calcium score. It's where they scan you. You've heard me talk about this. We look for plaque and calcium in the endothelium of the coronary arteries and in the aorta, and see if there is some significant disease. Well, all you have it, he had significant disease, very bad disease, in his left anterior descending artery, his main, we call it the widowmaker artery of the heart, and in his right coronary artery, a lot of calcium. Of course, I was very, very bothered by this, called him, put him immediately on a aspirin, put him immediately on some omega-3 fish oils, no exercise, things like this, got him right over within 24 hours to a cardiologist that I know, a very good cardiologist in the area at Beaumont, and he did have a heart cath within days, and had a stent put in his left anterior descending artery, and is having another stent put in his right anterior descending, or his right coronary artery, excuse me, next week. Blood pressure great, and doing wonderful. Felt a significant change, even though he didn't have a lot of symptoms. I saw him back here today, gave me a hug, and was very, very thrilled. I'm thrilled because, again, silent disease, and in him was probably a big risk, and some very bad, unfortunate events could have happened. So I'm happy he's doing well. But that's what you call individualized, personalized medicine. That's what you call functional medicine, looking at details, looking at root causes, and us thinking a bit and listening a bit. People need to be screened a little bit more, albeit often we screen and look at some of these things and are not find disease, and I'm thrilled. But it's that, 1 in 20, 1 in 30 people that get overlooked, and all of a sudden, boom, they have a big problem. So I want you to understand this. I want you to share this. I say this impassionately and caringly. Personalized functional medicine looks at root causes and can correct many things. So hopefully this enlightens you. Share it with others. I hope this educates you a bit. This is Dr. Lewerenz, Longevity Health Institute, today in Rochester, Michigan, throughout in Michigan, Madison Heights and Bloomfield, Michigan, have offices, have other practitioners that are working with us, wonderfully doing this integrative, functional, personalized approach. Always happy to help you. Phone number 248-289-6643. You can find us on the web. You can follow us on Facebook. I encourage you to, longevityhealthinstituteinc.com, and like us and share with others. We're happy to bring you the best in functional personalized medicine. This is Dr. Lewerenz. Be well.